So today we are going to speak about the anatomy of the larynx. Starting with the definition of the larynx. The larynx is a portion of the respiratory tract containing the vocal cord. It's about 2-inch tube and open into the laryngeal part of the pharynx above, and it continues with the trachea below. As you can see here, it lies between C4 and C7. So here is C1, C2, C3, C4, 5, 6, C7. So it lies from C4, this is the epiglottis, till the level of C7. Its function is swallowing and breathing and voice production. So the important relation of the larynx we should know. Here we have critical structures such as the carotid artery, as you can see here. So this is the larynx here in the midline. This is the carotid arteries. And we have also the jugular vein and the vagus nerve. So this is the vagus nerve and this is the jugular vein. Also another arteries here related to the larynx. We have this is the superior thyroid artery, and here this is the inferior thyroid artery. Also we have very important related nerve, which is the superior laryngeal nerve and the recurrent laryngeal nerve. So the structure of the larynx consists of 4 basic components. First we have a cartilaginous skeleton, which formed by cartilage. We have membranes and ligaments. We have muscles, intrinsic and extrinsic muscle, and the inner lining mucosa. The cartilage of the larynx include single arteries, single cartilage such as the thyroid cartilage, the cricoid cartilage, and the epiglottis, and paired cartilage, which are 3 small cartilage, which are arytenoid cartilage, corniculate cartilage, and the cuneiform cartilage. So all these 6 cartilage are cartilaginous except the epiglottis. So the epiglottis is formed by elastic cartilage. All other are hyaline cartilage except this epiglottis, which is elastic cartilage. So this cartilage is connected by ligaments, membranes, so they can move with the muscle contractions. So this cricoid, this is the thyroid, and this is the hyoid bone, okay? And this is the epiglottis. So starting with the largest cartilage, which is the thyroid cartilage, the single cartilage, and it has 2 lamina meet in the midline, and they forming this projection or V shape, which is known as the Adam apple, or this tubercle or prominence. Here we call it the Adam apple. And the posterior border of the lamina, it forms superior and inferior cornea. This is the superior and this is the inferior cornea, and this articulate is the cricoid, and this provides attachment for muscles. And the superior border is here, it gives attachment for the thyrohyoid membrane, which we can see here. This is the thyrohyoid membrane from the thyroid cartilage to the hyoid bone. The cricoid cartilage, here, this cartilage here, this cartilage before the beginning of the trachea, it forming complete ring. As you can see, it has two arches, anterior arch and posterior arch. The posterior arch is broader and it's forming the lamina. So as you can see here, the upper border the upper border articulating with the arytenoid cartilage. Here there is a synovial joint. This is a small cartilage, is the arytenoid, here articulating with the cricoid, and this joint, it is synovial joint. And the lateral surface, as you can see here, of the cricoid articulating with the big cartilage, which is the thyroid cartilage, and also it is the synovial joint. This small cartilage is arytenoid cartilage. As you can see, the shape is pyramidal in shape. It's situated in the back of the larynx and articulating into the upper border of the posterior cricoid. So the anterior cricoid and the posterior cricoid. Here in the posterior border of the cricoid, the arytenoid articulate. As we can see, it has three parts or three processes. This is the apex. The apex here articulates with the other small cartilage here, which is the corniculate cartilage. And this is the vocal process. As you can see, this is the attachment of the vocal cord. And here this is the muscular process, which here muscle attach. We have the corniculate and the cuneiform cartilage. These are two small cartilage we can see. The corniculate, as we have seen in the slide before, articulates with the arytenoid, and the cuneiform, it's a small rod cartilage. It's placed in each side of the epiglottic fold. So this is epiglottis, and this is the arytenoid at this side. So we have a fold here, which is known as epiglottic fold, and we can see these small nodules, which is formed due to presence of the cuneiform cartilage beneath it. So the cuneiform do not articulate with any other cartilage. It provides support to this epiglottic fold. So we can see here, this is the epiglottis, and here this is the cuneiform cartilage. This is the epiglottic fold. This is the cuneiform, and this is the corniculate cartilage. The epiglottis is a leaf shape and is situated behind the roof of the tongue. It's connected in front of the body of hyoid bone by the hyoepiglottic ligament. By a stalk, it's connected to the back of the thyroid cartilage by the thyroepiglottic ligament. Upper edge is free and laterally give attachment of the epiglottic fold. Anteriorly, mucosa is reflected into the tongue, forming three glossoepiglottic fold and vallicula. So here this is the tongue, and this is the epiglottis, and here you can see this fold, which is the median glossoepiglottic fold, and the two lateral glossoepiglottic fold. Between these two folds, we have this area, we call it the vallicula. Again, this is the epiglottis, thyroid cartilage. This is the arytenoid cartilage, and this is the corniculate. This is the cricoid from behind. This is the first tracheal ring. As you can see, the tracheal ring is incomplete ring. So we have membranes and ligament. So the first membrane we can see here is the thyrohyoid membrane. This is the hyoid bone and this is the thyroid cartilage, The membrane between is the thyroid membrane. In the midline here we have a ligament of thickening of this membrane, which is the medial thyroid ligament, and here we have the lateral thyroid ligament. Here we have another ligament which is the median cricothyroid, the cricoid cartilage and thyroid. So here we have the median cricothyroid ligament, and here we have the cricotracheal ligament or membrane. So this is the cricoid and this is the trachea. So this is the cricotracheal membrane. We have the hyoepiglottic ligament from the hyoid bone. This is the hyoid bone to the epiglottis. So this is the hyoepiglottic ligament. This is the epiglottis, and the thyroepiglottic ligament from the thyroid cartilage to the hyoepiglottis. So this is the thyroepiglottic ligament. Another membrane is the quadrangular membrane, which is here. This is the quadrangular membrane. It extends from the epiglottis down to the retinoid, and we can see here this is a free part of it forming by the vestibular ligament, which is known also as the false vocal cord. The cricothyroid membrane from the cricoid up here is the cricothyroid membrane, or the conus elasticus, which is very important, and here this is forming the vocal ligament part of it. So as you can see, the attachment of this membrane is here from the cricoid cartilage to the thyroid, and part of it's connected to the vocal process of the arytenoids, forming the vocal ligament. The laryngeal inlet. The laryngeal inlet, as you can see, it's formed here by the epiglottis, and posteriorly here we had arytenoid cartilage, and later we have the epiglottic fold. So the laryngeal cavity is extend from the larynx or laryngeal inlet down to the level of the cricoid, and here we see this is the trachea. So this is the laryngeal cavity. We can see two narrowing of this cavity. The first narrowing here at the level of the vestibular fold. This is the vestibular fold, and this is the vocal fold cord. This is the true vocal cord. So two narrowing. The first narrowing is the rima vestibuli, and the second one is the rima glottis. So this cavity is divided into three parts: the supraglottic part and infraglottic part. So this is supraglottic and this is the infraglottic, and the part between the vestibular and the vocal cord fold is called the ventricle. So this is the ventricle here, B. This is the supraglottic part, and this is the infraglottic part. So this is the laryngeal cavity. The most important is to know about the middle part. Here we have these cavities and sinuses and sacules, which is here, which is filled by glands that secrete mucus to moisten the vocal cord. So the cavity of the larynx is lined by ciliated columnar epithelium, and the surface of the vocal fold, because of exposure to continuous trauma during phonation, is covered by stratified squamous epithelium and contain many mucous glands, more numerous in the sacule, for lubrication of the vocal fold. So the muscles of the larynx. The muscle of the larynx is divided into groups: extrinsic and intrinsic muscle. Extrinsic muscle here this muscle outside the larynx, its function is to elevate or depress the larynx. The intrinsic muscle inside the larynx, and here either muscle controlling the laryngeal inlet or controlling the movement of the vocal cords. Regarding the extrinsic muscle, we had the suprahyoid muscle, which is fore muscle, digastric muscle. We had the stylohyoid muscle. Yes, we have the stylohyoid muscle, and we have the mylohyoid muscle, and we have the genohyoid muscle behind here. So this is elevate the larynx. We have also stylopharyngeus, salpingopharyngeus, and palatopharyngeus. All of this elevating the larynx. And the depressor of the pharynx here, also depressor of the larynx, which is the infrahyoid muscle, sternothyroid, sternohyoid, and omohyoid. And here this is the strap muscle here, sternothyroid, and this is the omohyoid muscle. We had two muscles controlling the laryngeal inlet: the oblique arytenoid muscle and the array epiglottic muscle. Here it is controlling this laryngeal inlet. And here we have the cricothyroid muscle, which is here from the cricoid cartilage to the thyroid cartilage. As you can see, when this muscle contracts, it pulls this thyroid cartilage anterior, so it tensioning this cord, so it increases the length and the tension of the vocal cord. The muscle that decreases the tension of the vocal cord is the vocalis muscle or the thyroarytenoid muscle, which here accompanies the cord. So this is the vocalis muscle, you can see. So it decreases the tension of the cord. Another important movement here is the abduction and adduction of the vocal cord. So here it's open with phonation and respiration, and here this is the glottis, which is the space between these two vocal cords. So here this is abducted and here this is abducted. So the muscle which abduct the vocal cord, they are two muscles: the lateral cricoarytenoid and the transverse arytenoid muscle. So this is the transverse arytenoid muscle, and here is the lateral cricoarytenoid muscle. These two muscles adduct the vocal cord. So when this muscle contract, the arytenoid rotate toward each other, so they are adducted. And even this transverse, when contract here, they rotate this arytenoid, so the two cords are adducted. The abductor, which is the most important muscle, is the posterior cricoarytenoid muscle, which is here attached to the muscular process of the arytenoid. So when this muscle contracts, this arytenoid will rotate like that, and here this will rotate like that outside, so the vocal cord get abducted from each other. This is important for air entry. There are two sphincters of the larynx, one at the inlet, which is used during swallowing, and the second one is as the rima glottis, and here used in coughing and sneezing. So the blood supply of the larynx, we had the upper half of the larynx is supplied by superior laryngeal artery, which branch from the superior thyroid artery. So this is superior laryngeal, this is the superior thyroid artery, and this superior laryngeal supply upper half of the larynx, and the lower half is by the inferior laryngeal, which branch from the inferior thyroid artery. The veins accompany to this artery, and the lymphatic drain into deep cervical lymph node. The nerve supply, so sensory innervation above the vocal cord is by the internal laryngeal nerve, which branch from the superior laryngeal branch of the vagus, and below the cord is by the recurrent laryngeal, which branch also of the vagus nerve. So here this is the internal laryngeal supplying the sensory supply of the larynx above the vocal cord, and the recurrent laryngeal here supply sensation below the vocal cord, and also supply the muscles. Most of the muscle of the larynx are supplied by the recurrent laryngeal. We have one exception, which is the cricothyroid muscle, which supplied by the external laryngeal nerve. So here this is cricothyroid muscle, as you can see, and this is the external laryngeal nerve supplying this muscle. So the production of voice is the function, as we mentioned, the function of the larynx. So it's very important to have a normal function, to have a normal voice production, and we have parameters such as the quality of the sound and the loudness of the sound and the pitch of the sound. All of this had control here in the larynx, which is the voice box. So the quality depends on the symmetrical vibration at the midline of the glottis. The loudness is influenced by the subglottic pressure and glottic resistance and transglottic airflow and amplitude of vibration. The pitch of the sound depends on the alteration in length and tension of the vocal folds. Here is some clinical notes about the larynx. Laryngitis with inflammation and infection of the larynx, edema of the laryngeal mucosa, and we have the laryngeal nerve lesions. Edema of the laryngeal mucosa, we can characteristics see with dye poisoning, hair dye poisoning, for example, causing this laryngeal mucosa edema, which is fatal. And we have the laryngeal nerve lesion, which could be external laryngeal nerve, either unilateral or bilateral. And we have also injury to the recurrent laryngeal nerve, which is unilateral or bilateral, or sometimes unilateral partial or bilateral partial. And here you can see this the vocal cord abducted in one side, and here is not functioning, and here also this is weakness, some weakness in the right side. Here is not moving with the complete injury of the cord. We can sometimes find partially moving of the cord with the partial injuries of the nerve. So here we have this is the side of the tracheotomy, which open airway to the lung below the obstructed larynx. So usually we cut between the first and second, or second and third tracheal ring. So this is a cricoid artery, and here is the side of tracheotomy, and this is the tracheal tube. Cricothyroidectomy, here we do it here between the cricoid and the thyroid, so we cut this cricothyroid also. The life-saving procedure for upper airway obstruction, can be done at emergency or at anywhere of the accident. So it's very important to know this position.